In this video, we're going to be doing the thorax and lung fields. First thing you want to do is inspect the chest. You're going to note the respirations, you're going to note the rate, the depth, if they're symmetrical, the rise and fall of the chest. You also want to check for pectus excavatum, which is the sunken chest, and then pectus carinatum, which is the protrusion of the sternum. Next thing you want to do is palpate the chest. So you're checking for any masses. He doesn't have any. The next thing you want to do is auscultate the lung fields. So you let your patient know, I'm going to be listening to your lungs. Every time I place my stethoscope, if you will take a deep breath. Good job. So we want the lungs to be clear. You can also hear adventitious sounds. The next thing you want to do for the anterior chest is percussion. So we're listening for resonance. If you go over the clavicle, it can be a flat sound. If you're over the heart or the liver, it'll be a dullness sound. Masses will also be dullness. So everything's good there. So if you'll have your patient turn for me to inspect the posterior. Hold right there for just 1 second. So also when they start to turn, you want to inspect the AP transverse ratio, and that is normally like a 1-to-2 ratio from the side. You're just looking for that barrel chest, which is the rounded chest, and he does not have it, so you can keep turning. So when you are inspecting, you want to inspect the respirations again, the rate, the depth, the symmetry, all that. The next thing you want to do is palpate. So something that you can do for checking the rise and fall of the chest for the respirations is also checking the costovertebral angle, which is where you place your hands. Okay, and if you'll take a deep breath. And watch your hands as they rise and fall and make sure they are both symmetrical. Next, for palpation, you want to ensure there's no masses, so you're just feeling. Okay. You are also checking, when you're palpating, you're checking for scoliosis, which is the S shape of the spine, and you're also checking for kyphosis, which is the humpback. He does not have either one. Next, you are going to auscultate the lung fields. You want them to be clear, but like I said earlier, you can have the adventitious sounds like crackles and wheezing. If you have crackles, that could indicate secretions. If you have wheezing, that could indicate airway obstruction. So when I place my stethoscope, if you'll take a deep breath every time, take your time, I don't want you to pass out. Also remember when you're listening posteriorly to go to the lateral sides of the lungs. Everything is clear, everything sounds great. The next thing that we're going to do when he's posteriorly is percuss. You make sure that you're over the lung fields. If you're over the scapula, it's going to have the flat sound. If you are over any type of bone, it's going to have a flat sound. Dullness is going to be like masses or fluids. We want the resonance, like the hollow sound. So. All right, everything sounds good.